Councillor Cassidy,
Present in the chamber.
Councillor Daisley,
Present remotely.
Councillor Jackson,
In the chamber.
Councillor McCluskey,
Present in the chamber.
Councillor Mackenzie,
In the chamber.
Councillor Quinn, Councillor Robertson,
She was present. I think she might be coming back home. Who else is left on this?
Councillor Robertson,
Councillor Robertson's emailed to say she'll be rejoining. She's having problems.
Councillor Quinn,
She's present in the meeting.
Are there any declarations of interest?
Okay, item agenda number 2, revenue and capital budget report. Witness Craig.
Okay, thank you very much, convener. Through yourself, this is the revenue and capital budget position in outturn for 21-22 and the revenue outturn position at the 30th of June 2022, and that's for the year 22-23. So first of all, the 21-22 outturn position was an underspending total of £221,000, and this went to general reserves. Within also in 22-23, that period 3, we're projecting a £975,000 underspend projection at this stage. Just a note of caution at this moment is just to highlight that this does not include any potential pay award costs that come through. That will be dealt with separately. So the main reason for the underspend at this moment in time is within vacancies within the system and underspends that we have in external home care. On the capital side, we currently for this financial year, we have a budget allocation of £1.3 million that's due to be spent on a number of projects. The majority of these projects will take place towards the end of the year, and the main ones are the new LD hub and the Swift upgrade. So that's the main highlights of the finances. Happy to take questions at this point.
Thanks, Craig. Do we have any questions for Craig? Stephen?
Yeah, so thanks, Colin. I suppose probably unusually in monitoring reports across the country at this point in time, projecting a large deficit, a large surplus is, as I say, probably unusual given all the pressures that we're seeing through systems. So I suppose in purely financial terms, that's to be welcomed. But I would be interested, and it's probably not a question for Craig, I'd be interested to know actually what the impact in terms of the issues that are leading to this underspend in home care, how that's manifesting itself in the quality of the service that we're able to provide to local residents.
Convener, through yourself, yeah, undoubtedly there is an impact in relation to the service. Members of this committee will know our home care service is the backbone of our services in Inverclyde. We're very proud of them, but we are not immune to the national things that are going on in relation to many employers fishing in the same pond for a group of staff. So that said, we have upped our recruitment. We are doing things I spoke to you before about having pop-up places where people can come in and do their application there and then, because folk had fed back to us that it was difficult and they found processes to get a job in the council a wee bit challenging, that people were a bit frightened of how to apply through computers, etc. So we are working really hard in relation to getting that recruitment right. We have got vacancies in. How that plays out in the operational sense is we are still providing good quality, safe services. The problem would be is there might be a slight delay. You'll know that over the last 5 years, we've had an exceptional record in getting people out of hospital. In the last couple of months, we have had a number of delays, and it's just simply making sure we've got the right amount of hours in the right place at Inverclyde to ensure that delayed discharge happens successfully. So you can have vacancies and still provide that same level of service. I would say the main impact is people waiting slightly longer for that service to start. So, for example, today we've got 9 people delayed in the hospital, but 4 of those are there because they lack capacity. So they won't move because there needs to be a court process. But unusually we have 5 people waiting for a care package, and whereas it would normally be ready within 2 or 3 days, people might be waiting a bit longer than that. So to answer Councillor McCabe's question, that's one example of the impact of that lack and the staff vacancies is that extension of time that people will wait. However, each of these areas we have their own specific issues, whether it's Port Glasgow, Europe. It depends whether we're using our own internal service or we're partners in the external. So there is an impact, and it's mainly on the amount of time that people would wait for their package to start. Thanks, Convener.
Any more questions? Can we read the recommendations?
Great.
Item number 3 is the Inverclyde HCSP draft refreshed strategic plan for 2019 to 2024. Craig, it's your end.
Again, thank you very much, Convener, and through yourself, this is the revised strategic plan for the remainder of the 2-year over the 5-year plan. So this plan continues to focus on the 6 big actions with the 49 key deliverables. And during the time period of April 22, we done extensive consultation on this via online surveys and focus groups. So we'd like to take this opportunity at this point to seek any feedback from the panel today on that particular refresh plan. Happy to take any questions.
Thanks, Craig. Do we have any questions for Craig? Stephen?
Yeah, thanks, Colin. It's a very readable plan, and certainly the big actions are, I'm sure, all big actions that we can sign up to, and there's obviously, I think, sort of 49 deliverables that flow below those. And a lot of them talk about continuing to do things, continue to support people, etc. I'm just trying to understand how this plan fits in, I suppose, with the improvement agenda, because there'll obviously be areas where we need to improve the quality service, and I know the challenge of doing that within diminishing resources is significant. But how does this plan, I suppose, highlight and identify areas that we need to improve, and how basically are we going to sort of monitor and measure that improvement journey? Obviously, in the council side of things, we have our director improvement plans, we set the objectives. So how does this sort of strategic plan feed into the improvement planning process?
Thank you. Okay, answer. Okay.
Convener, through yourself, I'll maybe start, and maybe other colleagues might want to come in. So this refresh, we've got 2 years of the plan left to deliver until we then need to look at our next plan. The thing around us taking feedback in this is what we want to do is between now and the end of December is work on a new updated suite of indicators so we can monitor performance and look at improvement. Councillor McCabe, so it's the one thing that's missing in relation to the updated plan. We did the consultation, folk recognise the 6 big actions they can see. So, for example, big action 4, we're moving forward with our new disability hub, which is going to improve the quality of services. The thing that's missing from the plan, and I think what you're referring to is the fact how you're going to monitor the progress. Well, we're going to do that by developing a kind of new set of indicators around what we have still left to do in relation to the plan. And we took the report to the Health Board, and they gave us useful feedback as well, and saying we'd quite like to see the outcomes that you're going to achieve for the rest of this and how you're going to measure that. So that's the last piece of work to do in relation to the refresh. Whenever we do this piece of work over the next couple of months, we'll bring it back to Committee and IIB for sign-off, and that will very much be a framework of looking at the outcomes we want to achieve next to the key deliverables, and there'll be performance indicators in relation to those. So that is the last piece of the jigsaw for this, and then interestingly, we get 2 more years to work on this, and all other partnerships in Greater Glasgow did a 3-year plan. Colleagues will remember we did a 5-year plan, so this is quite interesting because it takes us to 2024, and if we accept in theory there's a new National Care Service coming 25-26, there's an expectation there'll be a strategic plan with a new care board, so we will have to consider that near the end of this plan, what we do in relation to the current plan, taking account of any new direction we're going to get under legislation. So, Councillor McCabe, in answer to your question, we will be bringing back that outcomes framework before the end of January, so that members can comment on that and give feedback.
Just to follow up, Alan, it would be useful to sort of understand what sort of feedback you were getting in the consultation process, I suppose, about areas where the service users and families, etc., feel you need to improve. I mean, obviously, we're councillors, in some respects, we will be service users as well, but a lot of us won't necessarily be accessing a lot of services through the HSCP. So it'd be useful to get some sort of feedback and where people feel services needed to improve.
Convener, through yourself, thank you. Councillor McCabe, undoubtedly the COVID, the main responses we got back were in relation to folk essentially happy more or less with services. They're happy with home care, they're very complimentary about the service we're providing. I think consistency is one thing that came up around home care, about making sure they're trying to keep the same worker that coming in to the house. For example, folk gave us good feedback and been able to get through the new Access First, which is a new way that we handle our referrals. You'll see a lot of information around Access First, and that's helped people to get information. I don't think members will be surprised. Probably the biggest feedback we got in relation to this plan was in relation to primary care, and during the events that Your Voice held on our behalf, there was a general unhappiness with availability and getting access to primary care. Now that's been back a number of months, and I'd have to say we are monitoring how much face-to-face versus consultations going on through remote access to GP. So that is increasing generally month on month, but the majority of the feedback was really about if people are receiving a social work service, they were reasonably happy with it. I guess the main feedback was about consistency and making sure people continue to receive the same people coming in to provide personal care. But the big 6 actions, the other feedback we got was it was an easy thing to follow. People recognised it. They recognised that drug and alcohol was a big issue for us. They think mental health is a big issue for us. So they were the main themes, and as well as protection generally across the board, folk concerned about younger people and about children and the impact that's had on people's well-being. So it was generally positive. I said most of the issues came around consistency and delivery of care, and the main feedback again was around primary care. And I think, Convener, through yourself, Kate, would like to come in if that's okay.
Good afternoon, Councillor McCabe. Just to introduce myself, I'm Kate Rocks, and I'm now the Chief Officer of the HSCP. I suppose one of the things that has struck us through the piece, and certainly looking at the interim or the refresh plan, is that I do take on board some of your comments around whether the outcomes are smart enough and whether that we've put the right measures in place to deliver improvement, because the way it's been constructed. And interestingly enough, Warner and I were in a discussion this morning looking at the council plan, and we need to ensure that whatever the strategic plan looks like, though it is for the business of the IGB, but it needs a significant golden thread through the council plan, because actually we need to ensure that there's a mirroring going on in terms of the priorities that the council have, as well as the HSCP, because we're talking about the same people. So I do think that we will want to go away and have a bit of a refresh. There is a timeline and already starting to in place around the council plan, and that we want to play a significant part in that process. But obviously, any outcomes that we develop within that, we would want to see it being in our council plan too. So just to provide that level of reassurance.
Okay, thanks, Kate. Stephen, is that okay?
Yeah, that's been very helpful feedback, so thank you for that.
Okay, Councillor Bursky?
I'm okay. Stephen stole my question.
Okay. Councillor Robertson, you have a question?
Okay, thanks, and apologies that I was late. I had some technical issues, so thanks for bringing me in on this item. This is almost a kind of Councillor McCabe stole my question as well, so we're all obviously thinking in the same way, but I'd like to build on it a tiny little bit. I don't think that we've got unsmart outcomes in the plan. I just don't think there are outcomes at all. I think everything that we've got on the pages that are the action roadmap pages, everything there is being expressed as outputs rather than outcomes. And so when I'm looking at the recommendation that says we're to provide any final comments on the final draft before this goes to the IJB in September, it seems like a big chunk, quite a big chunk of what the strategic plan should be that's missing. And I'm wondering about the timescale of having things expressed as outcomes, which are the things that are measurable and tell us how we've made the difference that we want to make within that timescale, given the wording of the recommendation in the paper.
Convener, through yourself, thanks Councillor Robertson. Yeah, we took the plan to the Health Board. There was a similar discussion about perhaps just pausing and having a look at the outcomes. So we're certainly, my hand over to Kate, we expect to have a final version of this in terms of the outcome framework by the end of the year. So we could probably just adjust the recommendation slightly just to note that there will be a final plan coming forward with the outcomes, and then the scrutiny panel can give final comments back on that, if that's okay, the convener and the scrutiny panel. Thanks.
Any more questions? No. Any else recommendations?
Agreed.
Item 4 is the Unified Adult Support Protection Plan, Adult Support and Quality Improvement Plan 2021 to 22. Alan, maybe that's for you.
Myself, convener, sorry, Alan Best.
Yeah, sorry, Alan Best.
Sorry, too many Allens again. Thank you, convener. The purpose of this report is to advise the Social Work and Social Care Scrutiny Panel of the progress to date of the Adult Support and Protection Quality Improvement Plan 22-23. As the committee will know, the panel will know that in early 2020, all our adult services covering all service, learning disability, mental health, addictions and assessment care management were inspected in terms of its adult support and protection work. From that very positive report, there were a number of areas of developments that we were keen to take forward, and as a result, this plan was commissioned by the Chief Officers Group. From the report, an inspection led by the Care Inspectorate, Health Improvement Scotland and Her Majesty's Inspectorate of Constabulary. The recommendations for the scrutiny panel is to note the content of the report and the progress to date of the Adult Protection Quality Improvement Plan, which is detailed in the appendix. Also to recommend that following an audit of the impact of the improvement plan scheduled for 2023, the findings will be brought back to a future scrutiny panel. I'm happy to take any questions.
Okay, no questions in the chance here within the chamber. Any questions for Alan? So Alan, get with me.
Yeah, Convener, thank you. Just to make the point, we're very pleased with this report. We've worked hard on the improvement plan. I think it's important that members just let this report settle for a while and to think about it and reflect on it in terms of the level of assurance it's giving you around adult support and protection. We know that we'll have many challenges over the next couple of years, and external scrutiny by the Care Inspectorate is one of the very valuable ways that we can assure our elected members that it's not what Kate thinks or Alan thinks or SMT thinks, but you have a group of professionals, a scrutiny body coming in, looking at your service, looking at how you handle adult support and protection referral right through the process. And this plan is also heavily scrutinised by the Chief Officer Group. So it's just important to make the point The work is never done around this in terms of adult support and protection. It's scrutinised by the Chief Officers Group. There's a lot of good evidence in here and assurance for elected members that our key processes around adult support and protection are robust. They have given us areas for us to look at that we need to improve on. And we'll continue to work on those, but be mindful of this when you're looking and thinking about assurance around our processes around adult support and protection. This would be a document you'd come back to give yourself that reassurance. Thanks, Convener.
Okay, thanks, Alan. No questions? Any recommendations?
Robertson has a.
Could I just,
Sorry, Stephen, sorry, Stephen, got a question?
yeah, I was just going to ask you, Alan, obviously this improvement plan was developed on the back of the inspection and had certain particular actions to be completed, and I know some of them obviously do take some time to complete, but I suppose, is there an end game for this improvement plan? And I know the process of improving adult services never ends, but is there I suppose an end game for this plan, and you say, right, that's that plan completed and put to the bed, and obviously potentially at some point we'll get another inspection as well, but when do we see, I suppose, this plan completed?
Convener, through yourself. Thank you, Councillor McKay. Yeah, we have put in the majority of work into this, and we've been hard at making sure we've got the recommendations. Things move on, so the Care Inspectorate published some findings from a number of the adult support and protection inspections that they've taken. We were one of the first because we piloted it for the Care Inspectorate during COVID. It was paused. We went back to the Care Inspectorate and said, look, please use us as your guinea pig so we can complete this piece of work, because we wanted to get feedback that we could share in terms of improvement. So the issues that the Care Inspectorate highlighted to us in this plan are more or less complete, but we'll take this plan back to the Chief Officers Group, and ultimately there will be further publications that come out. We will sign off all the completed actions, and whatever actions are left, we'll carry those forward, but substantively we'll have met most of these recommendations. But there is work in process. We'll always be looking at our processes, looking at our paperwork. We'll have a new SWIFT system that will come in, so there'll be changes around the electronic information system. So it will go on, Councillor McCabe, but mainly we have addressed the issues of our working towards completing these. So by the time we take this back to Chief Officers Group, they will likely consider it, and they'll give us any feedback, and we will really more or less complete this piece of work, but we'll use it as a springboard for the next piece of improvement work, if that makes sense.
Yeah, thanks, Alan.
Councillor Robertson, a question?
Thanks, Councillor Jackson. I'm going to sound like a broken record, I'm so sorry, but again, everything here is about our processes and about things that we need to do, and I know that they've come from the audit that was taking place, but I still worry that having done all the activities within this plan are going to tell us is that our processes are better or have changed. It's not necessarily going to give us any measure of adult protection improving. You know, so the impact on the people that we're protecting, I'm not seeing. I guess that perhaps makes sense because it has come out of the audit, and we've got a set of actions that we need to follow through on. But if all we do is say we've changed our processes and we don't do anything, I think we're only doing half a job.
Convener, through yourself, Councillor Robertson, you disappeared a few times there, but if you remember back to the actual report from the Care Inspectorate, they made a comment on the outcomes that we're achieving for people within the adult support and protection process. So that's the baseline document that talked about we are protecting people while we're working. It's making sure that people are safer, so they've got a better quality of life. So all that information on the outcomes that the Care Inspectorate found were in the original document. This is, as you said, it's the action plan that we've had to take forward to make sure we've addressed the issues that they felt we need to take forward. But generally, the Care Inspectorate were satisfied with a positive report. They were clear with improving outcomes for the people in Inverclyde by using the robust processes around adult support and protection.
Okay, and whose recommendations? Kate?
Just to reassure you, Councillor Robertson, just out of an inspection of children's services in my previous local authority, at times that we are challenged around the care inspection as partners about what we're actually measuring. Is it processes or is it actually outcomes? And I suppose for this report, the areas of improvement were about our processes, because as Alan has already said, that actually they were able to find the outcomes. But actually we can never stand still, because even though we think we've done that improvement, we have to constantly test out that improvement, and we need to go back and revisit that. But there perhaps maybe is something that is missing about the experiences of service users that are part of that process, which it's not as experiential as it could be, and about whether they feel that we're actually making a difference. And I think sometimes that is lost in inspection reports. And maybe that's something that the Adult Support and Protection Committee can pick up and that can do a bit of work around that, because actually from my own experience, by going out and asking, and in this case it was children and their families, prior to, not to do with inspection, but to do with their own continuous improvement, about asking them about their experiences, that's where the real learning comes from. Inspection in their own right will only give us what a scrutiny body tells us. Care inspection might not be very pleased about that, but that's the reality of what we work. So we need to focus on, you're right, about what our citizens are telling us that have been part of that process. So I would suggest that we would go back and look at that and ask for a bit of work to be done. Maybe bring back to yourselves.
Okay, thanks for that, Kate. No one else, no? Agenda item number 5, Primary Care update on vaccination transformation programme and general dental services. Alan Best.
Thank you, convener. Yes, this paper covers 2 areas that have been for previous discussions from the panel, and it covers the 2 areas in terms of primary care of the vaccination transformation programme and an update on where we are with general dental services, which, whilst the HSCP doesn't directly manage those services, but we do link in with the board-wide service. In 1.2, in 2017, as part of the commitment to deliver new general medical services contract, the Scottish Government and the Scottish General Practitioners Committee agreed that all vaccinations would move away from a model that was based in GP delivery to one that was based on an NHS board delivery through specific NHS teams. The background was to develop GPs into the more specialist GP role and to move away pieces of work that could be taken up by other areas of the service. As such, health boards have assumed overall responsibility for the delivery of vaccination programmes, and all vaccinations are now delivered through a range of models, including board and local arrangements. NHS Glasgow and Clyde have a range of delivery models, some of which are still in development. The reason that they're still in development is obviously over the last 2 years, a lot of the capacity and focuses have been around the COVID vaccination programme and targeting resources to achieve that throughout the population. You'll see in section 3.2 where the vaccination programmes have been subdivided into sort of various areas such as travel, pregnancy, routine childhood, routine adult, seasonal, i.e. COVID, influenza, ad hoc vaccinations, where are vaccinations that are called for because of perhaps changes in somebody's medical condition and it's not a planned vaccination, and also housebound adult vaccinations for those who are unable to travel to a vaccination destination through perhaps mobility or health issues. I'll move on to general dental services next. NHS, as we know, there's been a lot of publicity both locally and nationally in terms of the dental services that are provided. NHS general dental services are provided by general dental practitioners. These dental practitioners are either in contract with or employed by their local NHS board to provide general dental care and treatment. The public dental service is a service provided specifically by NHS board employed dental practitioners. There's been a lot of pressure on dental services during COVID as other services. This has led to a lack of capacity within the dental services. Currently, it's not possible to register as newly with a dental practitioner for preventative treatment, and this has led to a challenging position again locally and nationally. Emergency dental treatment is still available through NHS 24 for those not already registered with a dentist. The position we have locally is we have 11 dental practices within the Inverclyde area, 3 of which are private practices. The dental professional body has raised issues around the remuneration for NHS work by dentists, and this has led to the position. What we have done locally within Inverclyde, there's always been the emergency dental service based at the dental hospital for emergency dental work that is not preventative, i.e. it's acute dental emergencies. We have spoken with our own dental service, the Oral Health Directorate Dental Service, which is hosted by East Dunbartonshire HSEP, and we have arranged that local emergency dental services will be provided from the 1st of August for 1 day a week from Greenock Health and Care Centre, and that will very quickly go up to 2 days a week, and that will allow people within Inverclyde who require emergency dental treatment to be seen locally rather than to have to travel up to the dental hospital. I'm happy to take questions in both the vaccination transformation programme and the general dental position.
Thanks, Alan. It is deep concern, Alan, that dental care is now going to be available to those who can afford it. So that is a really deep concern situation with dental care. Martin, you got a question?
Thanks, Todd. If you'll allow me, I'll take the vaccine stuff and then do dental, if that's okay. Probably also easier for Alan not to have to answer all the questions in one go. I think for many of us, this is probably, on the vaccination side, some of us, it'll come as a bit of a surprise that this passed over from GPs to the health board as a result of the 2018 contract. And the result of this, and the reason why I wanted to raise this today, is because of people coming to me with evidence of having to travel as far as Glasgow to get these ad hoc vaccinations. So many of these people affected by the ad hoc vaccinations are people with respiratory illnesses, for example. And the people that have contacted me regarding this were given the option where previously they would go to their GP surgery in Greenock in those cases, given the option of either travelling to the Central Mosque in Glasgow, which is actually a COVID vaccination site, or going to the RH in Paisley. A lot of these people are in quite poor health, some of them, that are being asked to travel, and it's also an additional cost at a time when they really can't afford it, to be having to travel far to get these vaccinations. So I've just got a few questions on vaccinations. Firstly, what are the numbers involved in the ad hoc vaccinations? Because on the numbers mentioned in terms of travel vaccinations, but what could we expect to see in terms of ad hoc vaccinations in Inverclyde? The second is, have the health board given any suggestion at all of when these will be available again locally, or how long we're going to have to face the prospect of people having to travel for them? And just finally, we're obviously in the process of rolling up the flu and COVID vaccinations for the winter. Is there no way that these ad hoc vaccinations, especially the winter months where we don't want people to have to really travel, is there no way that they can be provided at the vaccination centres that are going to be established within Inverclyde for flu and COVID? And would that be an option that maybe we could make representations to the health board to ask about? I'll pause there and then we can come back to dental, if that's okay.
Okay, no, thank you for those questions. To sort of answer the questions in terms of the ad hoc vaccinations between April and June, so 3 months for Inverclyde, there has been 70 ad hoc vaccinations that have been delivered by the ad hoc vaccination team. It is just to give reassurance to the scrutiny panel. Where a member of the public, a patient or service user identifies that they have issues in terms of if they have to travel for a vaccination, an ad hoc vaccination, and they have an issue in terms of they're unable to, either through a mobility issue or another issue, the housebound team can look at that and provide that locally, but that's on a case-to-case basis. What we have done is we have already made representation to the board through the vaccination group about Inverclyde's unique geography from the rest of the board. This is I think one of the issues here within the vaccination programme, it's been kind of caught up with the COVID vaccination programme over the last couple of years, and it's probably fair to say there's still a couple of bits of it that still need to be tested through a practical application. So that's why we have gone back to the board to say, would they look at a local option? And I know that has been progressed just now to see about whether or not something locally could be done. In terms of what you were saying there about the COVID vaccination, because of the scale of that, those vaccinations would be targeted, that the COVID vaccination, the flu vaccinated would be targeted for those two reasons, but I would be happy to take it back to see, and amongst that, if there's anything else that could be looked at as part of the model. In terms of the other figures I've got in terms of vaccination are for the travel vaccinations. As we know, that was something that was also previously provided by GP practices, and now NHS Glasgow and Clyde have commissioned that out to a provider, CityDoc, who have provided in the last 3 months 81 vaccinations, which is slightly higher than what's in the paper. That's probably just real-time information. But again, we asked for a local venue to be looked for that as well, and I understand that has been progressed, and there's a potential imminently that travel vaccinations would be delivered within Inverclyde. So again, but that's through a provider purely for travel vaccinations. But I can give reassurance to the panel, we have pushed back on the local issue.
And I'll just, apologies if I just didn't hear it there, but is there a timeline? Like, is there an indication of how long on the ad hoc vaccinations we might need to wait before there's a local option available?
I don't have an answer on that, but I do know that we had a vaccination meeting across Glasgow and Clyde this week, and the management within Glasgow and Clyde are away looking at the specific issue, and we will continue to push this, and if we have a timeline, I would be more than happy to come back to the panel.
That's great, thanks, Alan. Because just cotton up those numbers there, that's almost 300 vaccinations if you take it across the year, and we don't know if that might actually be higher in the winter than it is in the summer months. Just turning to the dentistry component of the paper now, I think all of us, I'd be surprised if no one hasn't been affected by this in terms of the length of waits for dentistry, but also in terms of constituents contacting us about lack of access to dentistry. That some people have called this a sort of privatisation by the back door, but I think actually it's more blatant than that. It's, we've got cases where dentists are actually off-rolling people who have been patients for years on NHS contracts and saying you can sign up to a private contract, or sorry, you'll have to go elsewhere at a time when there's no provision. Someone contacted me recently about their 17-year-old son, £180 for a filling. Someone else contacted me saying that they couldn't get their 3-year-old signed up to a dentist. So just on the dentistry thing, the questions are, how are we monitoring access? So how are we actively monitoring waiting times and access to dentistry, and whether this situation in terms of people registering for NHS dentists is changing? So that's question one. Second, it's welcome that there's extended provision for emergencies, but is there any way for us to open up additional routes for people who need preventative care, because if we don't get preventative care in place in terms of dentistry, they will turn into emergencies in the future. And aren't we better maybe trying to expand access to general dentistry services at the health centre so that we don't get to an emergency point? And finally, how do we deal with children in this? The programmes that have existed in Scotland for a long time now to try and get children signed up to dentists very early on have been very successful. And what we don't want is to see that fall off. So is this situation with people being unable to access dentists, is that also applying to very young children trying to access dentists for the first time, or is there a separate route that parents can go down if they want to register their child?
Yeah, no, thank you for that, Councillor. In terms of the general dental services, as I say, the HSEP is not in direct management of them, but we do link in with the East Dun HSEP, who hosts the oral dental service, the oral health directorate, and their criteria for access is around emergency treatment and also where there's a case-by-case basis of where somebody is, requiring a specific issue. They'll look at that to see if it's eligible for them to take forward. We also are linking in with the local dental practitioners forum in terms of monitoring the local situation, and also taking forward the comments that you've raised there are prime examples of comments that we are feeding back at the moment to the NHS dental service and NHS in Glasgow and Clyde, and asking these questions. And I'll be happy to, the one about the child, I can't answer today, I'm afraid. I'm very sorry for that, but I will take that forward to ask that question of the Oral Health Directorate so they get a more robust response back to yourself. As I say, at the moment, what we have done locally is, because we recognised, again, just probably similar to what you were mentioning before about the vaccination, that it's difficult sometimes, and especially we know that oral dental pain is one of the most painful types of pain that you can get. So that's why, if somebody's having to travel up to Glasgow, if we could get a local provision for emergency dental treatment, we put forward that argument, and we've been successful in the oral directorate, as I say, setting up locally for initially 1 day a week, now going to 2, just to monitor the usage of that service to see whether or not there's any room for any further expansion. Unfortunately, the preventative nature of it is still outstanding.
Thanks, Alan. Kate, you like that?
Sorry, just to pick up the issue about children, NHS actually do measure the access of children into dental. So we can get you that information, Councillor McCluskey. I couldn't tell you what it is, obviously this is my third day. There also is, there should be workers that are specifically part of the health visiting team that do that level of dedicated work, particularly in the hard-to-reach populations, to try and engage them, but they do measure the amount of 2 and 3-year-olds that are enrolled with dentists. So if we get that back to you, the chief nurse should be able to provide that information, because that would be given to her as part of suite indicators.
Okay, thanks, Kate. Stephen, you have a question?
It's more a comment, convener. I welcome the information provided in this report and being provided verbally as well, and I welcome the work that staff are doing to push back on these particular issues, and some of us have made direct representation on this, and there clearly has been some progress, but not enough as far as I'm concerned. I think the situation is wholly unacceptable. In terms of vaccinations, we should be looking for as many vaccinations as possible be carried out locally, so she would be continue to push back on that. And I think the situation with dental services, both locally and nationally, is wholly unacceptable. And as I said, well, I have every confidence in officers to keep pushing back on these issues. I think there is a role for this panel to be making representation, and I would certainly propose, Chair, and encourage you to write to both the Health Board Chair and the Cabinet Secretary for Health on these particular issues, to express our concern as a panel about the fact that the services are wholly inadequate, particularly in relation to dental services. I mean, those of us who are registered with dentists locally know that we've probably not had routine checkups for well over 2 years now, and that obviously I can have access to emergency services because I'm registered with a dentist, so it's not the end of the world that I'm not getting my 6 monthly checkup. Hopefully that will restart sooner rather than later. But the fact that people who aren't registered with dental services and who can't afford to pay for their dental health can't get access to NHS services is completely unacceptable. Completely unacceptable, and we need to make those representations in the strongest possible terms. So I would ask you, convener, with the support of the committee, to be making those representations on our behalf, both to the chair of the health board and to the cabinet secretary.
And absolutely, Stephen, we will take that on and we will make that representation, because as you quite rightly say, there's a lot of people who can't afford that. So we've effectively got a two-tier dental service. Within a cost of living crisis, people just don't have money, so they don't. So we'll take that forward and get a letter out to the health board and the cabinet secretary. Have any more questions? Have you made recommendations? Item 6, alcohol and drug partnership, naloxone project phase 2. Anne Malak, I believe this is yourself that's taking this.
Yeah, thank you, convener. So the purpose of this report is to provide an update on the ADP naloxone project and to outline a proposed second phase. People will know that naloxone is an evidence-based drug which reverses the effect of potentially fatal opioid overdose. The report describes the actions that the ADP have taken to distribute naloxone across Inverclyde, and it also describes the next phase to continue to increase the distribution across Inverclyde. And the recommendations are that we note the report and give approval that naloxone training can be delivered to both Health and Social Care Partnership and Inverclyde Council staff on a voluntary basis, and that includes supplying staff with naloxone kits for emergency use only, and that a supply of naloxone will be available as part of existing first aid kits within the HSCP and customer-facing council premises. And I'm happy to take any questions.
Councillor Brooks, you have a question?
Thanks very much, convener. Yeah, it's a report that obviously I think all members will be obviously welcome to read, because it's a very challenging issue, and we obviously have to make actions, and it's good to see the positive actions that are being taken. But can you just ask, is there any narrative that could be expanded on 3.4, especially when it comes to the table on page 77, that the target for 21-22 has only been reached at 12%, which obviously is a reduction on obviously the previous 2 years, and 12% of any target is challenging. So do we have any narrative to help us understand why only 12% was reached?
Yeah, so it was about the capacity to deliver that. We didn't have the person in post who was leading on that piece of work, but they're now in post and they've been able to deliver. So this year they've delivered 174, administered 174 kits. Obviously the training to staff would increase that further, and they've delivered training to 120 staff. So it's really about the capacity of the staff that has had an impact on the distribution.
Thanks so much, convener. That's helpful.
Councillor McKay, you got a question?
It was very similar to Councillor Brooks. It was to understand why the sort of, I suppose, the performance was so low and what we were doing to address that. So it's reassuring to hear the current figures for the current year, and hopefully the actions that's proposed in the report will increase that significantly as well. So I'm happy to support the recommendations in the report.
Yes, thanks, Stephen. Councillor Crosby?
Yeah, thanks, convener. And just excuse my ignorance on this, it's obviously great that we're going to have so many kits available, but how do we make people aware that they're available? To draw a comparison with the community defibrillators, for example, like if someone needed one of these, how can we guarantee that there'll be someone with a kit nearby? Does that make sense? I'm not sure I'm making myself clear here, but just how do we make sure that people know where to go if they see someone in distress who needs these kits?
Yeah, so our aim is to do this on a voluntary basis because it's not something that we can mandate that people do, but what we will do is keep a register within our HSCP and council premises of it, who has been trained and who is able to administer. So every building should have a first aid kit, every building should have a first aider. So at this stage, we would be increasing the amount of people who are available to administer it, but it wouldn't be, we can't mandate it at this stage that people will be comfortable enough to administer. So we're hoping that it's a spreading the news, making it more, increasing the amount of people who can administer it and getting people on board. So it's very much on a voluntary basis, but we will try and put some measures in place so that we're ensured we know where the people are that are able to administer it.
Okay, thank you.
Convener, just through yourself, and to add to that point, obviously members will be aware there is a kind of national naloxone campaign. One of Greenock's Own is one of the voices that is trying to publicise how naloxone can save lives. So I think it is for the ADP. You need to go back to the ADP and look at how do we up our game in terms of that public information, which I think Councillor McCluskey is referring to. So certainly from this report, the feedback Anne and I can take back through Kate and through the ADP that, you know, we would like to know what are the next steps in relation to once we get this group of people and we took this report to CMT, the Chief Executive is going to sign up to do the training as a few other, the management and the senior management team. So once we get that body of people together, we'll speak to the ADP about how do we get that public information out there so folk become aware of it and raise awareness around that issue, because it generally, it does what it says on the tin, it saves people's lives. So we should really, if we have the capacity, we should be publicising that and getting as many people as possible to sign up to be able to undertake this really important task.
Yeah, I suppose, again, I'm not taking the Fifth Amendment, I'm on here, but it does make me think about, should we be targeting specific areas where we know that overdose is more likely, and who is around in that community that can save lives? And certainly one of the things that I've looked around the ADP plan, and we'll speak to Kenny, who's the chair, is that we have to be a wee bit more targeted in where we put our effort. So I don't know where that is in Inverclyde, but I can tell you that the police would know where the likely hotspots, and are there local shops, takeaways, taxi ranks that might well be part of that community response, because other places when we've done things like that, it's amazing how much the community comes on board when they are given the opportunity to get that training too. So I'll be keen to have that question of Kenny to see if we could do a bit more of that analysis to look at the various hotspots.
Thanks, Kate. I think you made a very good point there that we should be tying in the police and local intelligence to find out best places to operate these. Councillor Robertson, you have a question?
Thanks again, Councillor Jackson. So where we're talking about the police, I'm looking at 3.7, where we note that the Police Scotland pilot is completed, as it says here. We were obviously disappointed that one of the pilot areas chosen wasn't Inverclyde, so we were disappointed we weren't included in that particular pilot. But if it's concluded, I'm just wondering if we've got a mechanism for us finding out how that pilot went and what the police are intending to do on the back of it, because it would be really, really useful to one, know that information, and two, try and make sure that the police are rolling this out right across the country.
Thanks, Elizabeth. Any more questions? Can I give the recommendations?
Sorry, can I get an answer to my question? Is that okay?
Of course. Sorry.
Convener, through yourself, yes, we can take that as an action, Councillor Robertson. We'll find out the intentions. I think also said fire and rescue are now rolling it out. I don't think the case needs to be made now about how important this is. So I think we're knocking at an open door. And if you just take the council CMT an example, when we ask folk are more than willing to come forward, most of us live in our community, so I think we will get a really good response to this, and it's because it's the right thing to do. But we go through, it says through Kenny and through Anne, we can make sure we get access to that feedback.
We have Elizabeth. Okay. Agenda item number 7 is the refugee resettlement and wider dispersal and the
Convener, thank you. Through yourself, a brief report on the update in relation to the refugee resettlement and wider dispersal. I think it's safe to say this is one of the most significant pieces of work we're involved in at the moment from the HSCP, working directly with the Home Office and the National Government in London, and also with the Scottish Government in terms of Ukraine. You won't be surprised to know that our community has opened their arms up to people who are facing some terrible issues at the moment, and the Home Office directly got involved with the Holiday Inn, and they're using that as a contingency hotel. Members will know there's over 60 people living there at the moment, and the hotel has done a good job in establishing itself. The HSCP has wrapped care around the people that are living there at the moment in terms of making sure mental health assessments are being completed and making sure the people that are living there are getting access to some meaningful activity, and we'll get excellent relationships with the third sector. Your Voice and CBS have been putting in lots of, you might well have seen some of the social media around this. There's the third sector are coming forward with meaningful activities. The community have came forward with all sorts of offers. We got £1,000 from the Rotary Club this week that Your Voice are going to distribute to some of the refugees. So our community keeps up coming forward and helping us. Now, that all aside, it is a real challenge for us in HSCP. We've got the Gym Hotel with Ukrainian families there at the moment. We have the hotel for the asylum seekers. We're also looking at the wider dispersal, so we're working with Scottish Government and the Home Office in relation to a registered social landlord, so we can look at a strategic look at how we might be able to offer some permanent homes for the refugees and the people who have been fleeing the violence in Ukraine. So there are daily meetings in relation to this, and it's a two-pronged approach in terms of work with the central government around the asylum work and working with Scottish Government. The feeling is the system is still heating up. We're not at the end of this by no way, and it's an evolving picture. And we're at a meeting with the colleagues from Glasgow on Tuesday around the latest developments in asylum with the Home Office. So Inverclyde wants to be part of this. We want to see what opportunities will be open to us moving forward in terms of Ukrainian families. Our schools are going to accommodate the young people who are there. We've got each of the people registered with a local GP. So we're still in some sense at the start of this process, but the paper in front of you today just gives you an update, and I expect the scrutiny panel will be looking to be kept up to date, both in relation to the work we're doing with the national government around asylum and the Scottish Government around the people that are fleeing violence from Ukraine. So our chief nurse has been heavily involved in this as well, Laura, as has Alan, and we'd be happy to take any questions. Thanks, Convener.
Thanks, Alan. Councillor McCluskey.
Thanks, Convener. Alan, thank you for this report and for all the work that the whole team are doing around this. It's a great piece of work. My question is just specifically on Ukrainian resettlement and the Homes for Ukraine scheme. There was some coverage in the media earlier this month about 23% placements potentially breaking down at the end of the 6 months. Do we have any placements that have broken down? And in the event that any do, have we got some sort of contingency in place to rehouse those people?
Convener, thank you through yourself. Councillor McCluskey, yes, it would be a surprise if we hadn't experienced this. And I'm Glendinning, my Chief Social Work Officer, is very much involved in this work as well. I'll say briefly to you, yes, there have been a small number of breakdowns and we've stepped in and offered alternative accommodation. I think it wouldn't be a surprise given the trauma that the people that have came to Scotland, because it wouldn't be an easy thing to do, to leave and head to the other end of Europe. So we are not surprised. We're wrapped around mental health services around this to make sure that people receive a mental health assessment, a check-up, and also their kind of wider needs. So unfortunately, there is a lot of trauma. We have some people here whose families are still back home involved in the war, and there are other people who are not there involved in the war. So tensions are quite high in relation to that community, and we are working really hard to make sure that we assist folk to kind of make that transition, but it's not an easy time for them. And I don't know, Anne Glendinning, my Chief Social Worker, would want to add anything else, Councillor McCluskey.
Yeah, really just to reiterate what Alan has been saying, I think it's very complex in terms of homes for Ukraine. People have opened up their homes, taken families in, and the level of trauma and difficulties, you know, so it's really important around the support that we give. But I think all local authorities are beginning to see breakdowns, which is unsurprising. I think this is something that we're constantly going to be learning. I think we've all stepped up and opened doors to help, but you know, we do need to learn as we go along about what supports are required in order to make it work, and also the throughput, because we know this isn't a short term, you know, that this war is, you know, we're going to go on for some time, so it's important that we all rally around. But really just to reiterate what Alan has said, you know, the support that we've had from third sector, from Scottish Refugee Council, a massive work that has been done, so, and we'll keep that going, but it's resource heavy, but we have got a good level of governance around it, and as Alan has said, we're all involved in at least one or 3 meetings every week around this.
Thank you.
Thanks, Councillor Kenzie.
Well, thank you, Fiona. Yeah, the Ukrainian situation is that the people who are here and people who probably join them, it doesn't look as if it's going to be short term. It looks as if it's going to be long term and perhaps indefinitely. Now, with staying in this area, they will look to be housed eventually and move away from the sort of hotel accommodation. Now, I don't want this sounds sort of opportunistic, but there are certain areas of Inverclyde that would be very suitable for rehousing them. And I think of a place in my own ward, and I'm sure everybody else can think of others. For instance, the Chapelton area of Port Glasgow, which is an excellent area and traditionally has been a very good place, but it is in decline, and there's quite a lot of housing stock there lying empty. And in order to address this decline, I understand there is money from central government to accommodate the Ukrainian crisis. And would it be proper of Inverclyde Council to target that area, to enhance that area, and that would be for the benefit of the Ukrainians that are coming here, and also for the benefit locally, and a win-win situation long term.
Convener, through yourself, thank you, Provost. Yes, just to give some reassurance, Stuart Jameson is working alongside us in relation to the work with the registered social landlords. We are taking a strategic look at this because as a CMT, we absolutely understand that there's a crisis at the moment, but you have to lift your head, scan the horizon and see what the opportunities are in the medium to long term. So all the registered social landlords are working with us at this moment to look at what the opportunities are in relation to when people make the decision to stay in Inverclyde. We want to be in a position that we are able to offer them suitable accommodation and in the mix of whatever else is going on for the registered social landlords. So we are involved in a piece of work so that it's strategic in nature. We look across with the registered social landlords and we look at the opportunities, and that will also include an opportunity and engage with the Scottish Government to look at is there capital funds that we can secure to assist the registered social landlords to actually bring accommodation back to life again. So the situation you're describing is the conversations that we are currently involved in at the moment, and they are progressing. And I said Stuart Jameson is leading that piece of work around that work, so you can expect at a future date we will be coming back and updating the scrutiny panel on the decisions that we've made and how we're going to take that forward. But there are opportunities. Just now though, people are in a bit of flux because they're trying to decide if they've got family in other parts of Scotland. So we're having discussions with families saying, do you see Inverclyde as a place that you'd like to raise your family with access to schools, with access to good services, good schools, all the rest of it. So these are the conversations we're having, and while these conversations are going on, the strategic piece of work at the executive level is going on to look at how can we maximise opportunities, and that will include an ask from us to Scottish Government around is there capital potentially available, because members will know the example is in North Lanarkshire. North Lanarkshire got a significant amount of money to bring back a tower block back into life again in order to use that. So although we don't have something at that scale, there will be a discussion in the coming months about how we can maximise that opportunity, and if there's funding there for capital, we will be looking to make some kind of application to access that money.
Councillor McCabe.
Thanks, convener. Very much welcome this report. It obviously demonstrates the scale of the work being done in this particular area to support these very vulnerable groups, and it's good the way in which Inverclyde is reaching out. So I would, like Martin, commend the staff, their partners, and the wider community for the way in which we're supporting these various groups. But my question was in relation to Section 4 of the report dealing with capacity. I suppose Section 5 dealing with the implications, in particular the financial implications. There clearly are a number of streams here, lots of funding coming through, need for additional capacity, etc., need for a lot of support for these particular groups. And we're obviously managing significant amounts of fund. I think part of our role as a scrutiny panel should to be ensure that those resources are being effectively managed. So I think it would be useful in the next report that we get on in terms of these programmes to get a greater perspective on the level of funds and how they're being utilised, because it is important, I think, to ensure that, and I don't have any doubts this is happening, but it is important to ensure that public funds are being properly managed, and also that we are obviously receiving the resources that we require from both governments to provide the services that are needed by these refugees. So if I can make that request that we get a more detailed financial report within the next report that we receive.
Convener, through yourself, that's absolutely fine. Councillor McKee, we're planning to bring forward, as you quite rightly said, it's a very complicated picture in relation to funding, but both Alan Puckering and Craig, who's on the call today, their teams are working together on this to make sure, because Scottish Government and others will be looking for a proper audit trail of the money that's coming through and how that's being used. So a future date, when we bring the next update, we'll make sure we cover where we are at that specific point.
Thank you.
Thanks, Alan. Councillor Quinn, you have a question?
Yeah, thank you. Yeah, just a question for Alan. Thanks for the report. It is great to see the update and how things are progressing. So thanks for that. So, I mean, obviously it links back to our previous item. So I've got a question on capacity. So absolutely, those folk are, you know, it's been great seeing that Inverclyde has given them a really good warm welcome. And obviously we want to do everything to support them. But when we're talking about capacity, so we've already been discussing about access to dental practice. You know, there's been a question about access to GP appointments. How is that being managed? You know, is that being fed back to the Scottish Government that we've got an area already under capacity and this will add? And quite rightly, we want to do that. It is really about increasing capacity and not to make anybody feel unwelcome. So I just wanted to explore that a little.
Convener, through yourself, thanks, Councillor Quinn. Yeah, when we have our discussions, each of the local authorities are very forthright in describing the current pressures they have in their own areas, whether it's issues in relation to remote and rural. So we are going to these discussions in a positive way. We are looking for opportunities, but we're also making it clear that with that would come an expectation that there would be a resource to follow that, because we are working with the two hotels. We're looking at supporting people that are moving out into the community. So you can't do that, continue to do that, unless you get a level of increase in funding. So whenever we're having these discussions with, whether it's the Scottish Government or the National Government, we're making it clear that we are interested in having these discussions, but also making it very clear that there would be a capacity issue for us. And for example, the current GP contract, it's a centralised system. So when we get information through for the people that are coming to the Holiday Inn, for example, these people do have access to a GP. It's done through a centralised system. It's allocated out so that we don't miss anyone. But to reassure Councillor Quinn, when we are having these conversations, there is also a resource discussion at each point, and we are quite clear there would be a tipping point for us at the moment, because it is a bit of a crisis situation. Every local authority in Scotland are being asked to do their very best at the moment. We're happy to be part of that, but we are also mindful of we know ourselves where our tipping point is, and any further significant increase for us, it would need to be tied into the resource. So, for example, we've had to increase our New Scots team, and if we were looking to take a significant number of additional people in a short time frame, we would need to look at how we resource that, whether it's additional nurses and additional folk in the team, and we need to make sure that people get access to primary care. So it's a delicate balance. We accept that, but we do go into that conversation each time, making sure that people understand that although we are a very welcome community, our resources are limited. So any further significant increase, we'd be looking to make sure that's tied in the discussion around additional resources.
Thanks, Alan. I think it's important as well to recognise that, how good a job our officers have done in this, because this came in very quickly, and the officers, I was very fortunate. I had the opportunity to go to the holiday and meet with officers and the head nurse, and to see the way the officers, the third sector and the volunteers have rallied down, it's just incredible. So I want to, on behalf of this committee, thank them for all the work they've done. I think we need to, they rose to the challenge. They've done a great job so far. Just on your point, Councillor Mackenzie's point, I think the refugees, when we look back to Afghanistan, resettlement, this Inverclyde was very welcome, and I'd like to think that if anybody from the Ukraine wanted to stay here, then we would do all we can to help them resettle. I think it's important to recognise that and welcome them. So thanks for saying that. That's great. Do I read the recommendations?
Agreed.
Item 8 is the Parole Board Scotland Victim Safe Space Initiative. And I believe that's yourself.
Yes, convener. So this report's for noting. It's a request to Scottish local authorities from Parole Board Scotland in respect of the Victim Space Initiative. Do you know parole boards consider cases of prisoners who are no longer deemed to be presenting a risk to public safety and would have their sentence carried out in the community. Changes to legislation have meant now that victims have a right to be notified of prisoners' release, and for some to take part in a video link observation of the parole board hearing. The request to local authorities is to provide a safe place for these observations to take place. Scottish Fire and Rescue in Port Glasgow have stepped up to the mark, and they're offering a premises here, and the ask of Inverclyde is that we would provide the same. We anticipate that the numbers for this will be very low. We've had no requests to date, and we think it would probably at the maximum it would be 2 or 3 cases a year. Therefore, we're leaving it open. What we'd want is it would be a case-by-case basis as to where we would offer a venue to a victim to observe. Parole Board Scotland will manage that process, and they'll be responsible for the IT of that, and we will be given plenty of notification. So really this report is really just for notification of the offer, the ask that's out there, and our participation in that scheme. I think it's a good opportunity. We're looking very much more across the council at being trauma informed, and again this is an opportunity for us to think about the right venues and how we support victims of crime.
Thanks, Alan. Alan, this.
Convener, no, I don't have anything else to add to that. Just thank Anne.
Okay. Do we have any questions? No? Have we any recommendations?
Great.
Item number 9 is the National Care Service. Morna, I believe this is you taking this.
Thank you, Convener, and good afternoon. The purpose of this report is to seek approval of the Council response to the call for views on the National Care Service Bill. Members had an opportunity earlier this week to give feedback on the draft response. We made a number of changes arising from that, and the appended response reflects that. Any further changes arising from this panel can be made prior to final approval at the 23rd of August Policy and Resources Exec Subcommittee. And I'm happy to take any contributions or questions from the panel. Thank you.
Pam, you have a question?
Well, I have a number. Thanks, Convener. I have a number of points, and they're not in any particular order, but they're all intended to add to the response rather than contradict anything that's already in it. So I just think that we should be strengthening the aspect of the response to be clear that we would rather build on our IGB rather than, if you like, have it completely replaced by something that is centralised and with little or no democratic accountability. If there are problems with IGBs elsewhere, I don't think Inverclyde should become, if you like, a victim of that. I think there seems to be a concern that complaints processes are inadequate, and my view strongly is that that is not the case in local authorities, nor indeed in the voluntary agencies from whom we commission services. If there's a problem with complaints procedures, then locate it where it is, I would argue. The next point, I think we should point out that Inverclyde is one of only 6 mainland authorities where the staff employed in social work and social care are predominantly in the public sector. Now, the only authorities in Scotland, as I say, there are 6 mainland authorities plus the 3 island authorities, but all the other Scottish local authorities, the preponderance of staff is in other sectors. And it's not all, mostly it's the private sector, but it's not all. Glasgow, for example, it's the voluntary sector. So, but for a small authority like Inverclyde, the fact that most of the staff are in the public sector, I mean, it will have a greater impact. The creation of a national care service, will have a disproportionate, could have a disproportionate effect on Inverclyde. And I think during the presentation at the time, I think I commented that the bill doesn't include more of what I would certainly argue are more important aspects of the Feely Report's recommendations. So, for example, the removal, the Feely Report recommended the removal of non-residential of charges, for non-residential social care support, and an increase in the sum paid for free personal and nursing care for self-funders in care homes to the levels in the National Care Home Contract. I think, again, the bill is absolutely silent on the inequity of individuals, for example, with advanced dementia who are receiving nursing care in a care and nursing home, who, if they have the ability to pay, they have to pay. But if the same individual happens, for an individual with the same medical condition is in an NHS facility, then that care is nursing care, is free at the point of delivery. And I think at the very least, we should be urging an increase in those levels. I would urge, for example, in Wales, the figure is 50,000. I think we should at least be aiming to equal that. And finally, I think we should pose the question as to whether local authorities are to continue to have a duty to promote individual and social welfare, because of all the services that potentially could be swept up into a national care service, you wonder what a local authority is actually supposed to do with that duty. I think that's it. Thanks very much. Sorry.
Thanks. Councillor McCabe.
Yeah, thanks, Chair. Had a read through the draft response and certainly can see the changes that have been made in the back of the session we had yesterday, was it, I think, or the other day. Just one point under question 6, the first paragraph of the responses: children's services and justice services should be removed from the scope of the National Care Service. I just felt it was maybe following that up with another statement perhaps around sort of that we don't believe that secondary legislation is appropriate to sort of, I suppose, make such fundamental changes. So it's about, I suppose, just emphasising that while they might want to at a later date consider that we just don't think they should be doing it in the context of secondary legislation. But apart from that, I think it's a very well written response, and commend officers for all the work they've put into it.
Yeah. Thanks, Stephen. Martin,
yeah, thanks, convener. I think that the interesting thing about this is I think most of us, certainly party representatives, that we've all had this in our manifestos, but all of us have grave concerns about it, which I think says something about the content of the bill. And I agree with a lot of what Councillor Armstrong said in her remarks, because I don't think it really, as it's proposed at the moment, it doesn't solve the problems that a lot of people would have expected it to solve. So, for example, the dementia point that Councillor Armstrong raises, the capital limits, the funding for adult social care, the state of the workforce, all of those issues are actually, we're left with more questions than answers in this. But I think it's important, and I made this point the other day at the session as well, it's important to bear in mind this is going to happen because it's a government bill and the government will get it through Parliament. So I suppose we also need to think about how we tweak it. And just a few comments on the submission, just having reflected from the other day. The first is on under question 1, where we say there's no evidence that suggests a national care service will improve quality. There's a question mark for me in that about, it does sound like that we're saying any national care service, and I think a lot of us in this room would support the principle of a national care service, just not the way it's laid out here. So I'm wondering if we can make that, just tweak that a little bit to make that clear. The second thing, which I didn't really see reflected in this, is just on the size of care boards. Again, the suggestion seems to be coming that care boards might be analogous to the health boards. I don't think any of us would want to see that. So I know that this makes reference to IJBs and that being a good model, but I think we should also be saying we don't think that delivery at a regional level would be appropriate, again, because this is probably likely to go through. Third, can we put reference into the admin costs involved? The financial memorandum talks about £500 million of admin costs. Now, £500 million going into social work and social care delivery could be, don't ever go as far as transformational, but it would make a very big difference. So, can we highlight the fact that this bill is actually proposing putting £500 million into admin costs? And the final thing is just to reinforce what Councillor McCabe said about secondary legislation. It's not just powers that are being left to secondary legislation and functions of local government. It's assets. It's all sorts of different things that could be, on the stroke of a minister's pen, be brought from local government into the Scottish government. And I don't think that's something that any of us would be comfortable with. Thank you.
Thanks, Martin. Mona, welcome back in again.
Thank you. Just to reassure members that I've been scribbling away throughout that, and I've taken a note of your comments, and happy to pick that up in the draft and amend that accordingly.
Okay, thanks, Mona. Anybody else? Do you make any recommendations?
Great.
Yeah, I think that's about social.
Just wait a moment just so the stream starts.